Hello everyone and greetings from Canada. My name is Walter, and I'm coming to you today from the School of Optometry at the University of Montreal. I would like to begin today by acknowledging that Montreal is located on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of these lands and waters from which I present today. Churchage, which is commonly known as Montreal, is historically known as a gathering place for many First Nations. Today it is home to a diverse population of Indigenous and other peoples, and I want to express my respect for the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples within the Montreal community. Now let me start today by saying congratulations to Annmaree and Moira for their marvelous work on their new book, Dual Sensory Impairment and Older Persons, an Invisible Epidemic. Well done, ladies. Very proud of the work, and I want to congratulate you for your accomplishment. Now, of course, it turns out that the work is more relevant now than it's ever been because the numbers are going up. And it turns out that the numbers are going up everywhere. Recently, there was a review of data available across all 6 regions of the World Health Organization, and specifically in the Western Pacific region, when you look at the prevalence at the population level of individuals living with combined vision and hearing difficulties, the percentage is up to 7.5% when you get to the level of centenarians. And of course, we know much about the higher prevalence in more specific environments like long-term care or palliative care. Now, the question, of course, comes up, why should we care? It turns out, because of this increase, there's great need to also increase awareness, knowledge, and skills among all parties that are involved: students, professionals, practitioners, and also future policymakers. But let me give you a few examples of how bad it really is. Now, I'm going to speak to you about the Canadian context, but I've been to Australia a couple of times now, and what I've learned from my travels is that we are more alike than we are different. Our population demographics are very comparable. We're not really that different in size. So there are many things that are very similar, including our distribution of the population. And so in 2015, we conducted an interesting survey that is relevant for us today, where we basically asked people during their professional training as occupational therapists whether they learned about dual sensory impairment, its effect on occupational performance, or its rehabilitation options. And it turns out that at least 75% and more either had never learned of any of this or did not remember that they ever learned anything like this. What was also interesting is that when we explored whether there were clinical placements, assignments, or guest lectures, the large majority said that that never happened. But it is fascinating that now that they are employed specifically with working with a gerontological clientele, more than half of them have clients that live with combined vision and hearing impairments. So we then went back to their training programs, especially in Canada. There are 5 universities that provide occupational therapy training. And we explored specifically what people are being taught about dual sensory loss. And it turns out 2 of those undergrad and 1 of those master's programs do not cover the topic at all. One was mentioning that the topic is mentioned, but definitely less than 10 minutes over the course of the entire degree. We had one program that claimed they present case studies on the topic, one program that explored laboratory or invited speakers on the topic. But you can tell it's pretty thin, and it's probably not enough. I have currently a student, Shirley Dumassé, who is further exploring this topic, and 10 years later, we were hoping that a lot of this may have been fixed in some way, but it turns out that OTs still lack training to identify the presence of dual sensory loss, specifically and particularly with older clients. But they also do express a need for continuing education opportunities and for additional knowledge and training about dual sensory loss. So you can see that Annmaree and Moira's book is more relevant now than ever. It is an excellent place to start learning more about aging and dual sensory impairment. And again, congratulations on your work. Have a wonderful book launch today, and I wish you well. Thank you for having me. Take care. Bye.